and we asked him to answer this question. The recent CHIA report shows substantial increases in insurers' revenues and premiums, but the percent of medical costs covered by insurance plans has actually declined. At Tufts Health Plan, premiums have grown at the highest rate of all insurers from 2009 to 2011. Are we being asked to pay more money for less coverage? And what is Tufts doing to reverse this trend?
So I'm going to introduce myself as I have at other GBIO meetings that I've been sitting around in a circle at. I'm Jim Roosevelt from St. Peter Parish in Cambridge. At the centerpiece of what we do at Tufts Health Plan is our coordinated care model. The same goals as the AQC described by Andrew, but with a different methodology. The coordinated care model aligns provider contracting, care management, and product design, which has resulted in a higher clinical quality while mitigating healthcare costs. We engage providers with global payments, which are based on value and quality-based measures. Members make decisions based on what they're willing to pay. Access to medical care is always present. If a service isn't available at one level, the member receives the care at a higher tier, but only pays the tier 1 copay. Providers remain inside their tier whenever possible when making referrals. And thirdly, we work with members to keep them healthy. We have wellness programs with tools and resources to manage wellness. We work with physicians to manage members facing significant health issues, and we work proactively with members by sending care alerts. So let me add that all of the Massachusetts health plans do this while paying almost 90% of what we collect in premiums directly to providers. Our administrative costs of approximately 10% are by far lower, by 5%, are by far lower than plans anywhere else in the country, where administrative costs tend to run from anywhere from 15 to 25%. Commenting on the recent CHIA report, which shows substantial increases in insurers' revenues and premiums, first let's address the trend that you're referring to. When we talk about out-of-pocket expenses and we talk about the things that are paid for by insurance. We need to be careful when we discuss that because we may be talking about something we don't want to reverse. Let me explain. We're referring to things like substitute. When we talk about benefit changes, we're referring to things like incentivizing members to use generic drugs instead of brand names that have no greater value. We're talking about getting care in more effective locations that is of the same quality or higher quality. At Tufts Health Plan, our year-over-year rate increases have been in line with or better than our competitors. The figure that's referred to in the CHIA report does show that while we had the highest increase in those particular years from 2010 to 2011, the premium per member per month at Tufts Health Plan was $10 lower than Harvard Pilgrim and $4 per member per month higher than Blue Cross